Well, a very, very good afternoon, everybody. A very warm welcome to today's webinar, Resolving Grievances and Complaints in the NHS and, of course, in other healthcare organisations. It is great to have you here today. My name is David Little. I'm the CEO of the TCM Group, the UK's mediation and dispute resolution experts. And we're here today to talk about a very important topic for an increasing number of NHS trusts. And that's about how do we get a grip on these challenging issues relating to conflicts, disputes, bullying, complaints. The real challenges that we know are starting to be flagged as a major area of concern for a great number of NHS business leaders, HR professionals, and many, many others. So today what we're hoping to do is to share with you some ideas, some thoughts, some approaches that we've been using over the last 15 years as a mediation organisation, working with a wide range of NHS trusts, helping them to get a grip on conflict and embed a culture and an approach which is collaborative, which is sustainable, and which secures lasting and positive and constructive outcomes during difficult times in relation to conflict, bullying, grievances, and of course patient complaints. Some of you will know me. I know some of you on the webinar here today we've worked with over the past, so it's great to have you back here. I hope that we can share some new insights and some new information with you. So those of you new to TCM, a very, very warm welcome, and I hope that you get a lot out of today's webinar. So there's our pictures. Just to introduce ourselves, I'm David. I'm the founder and the CEO of the TCM Group. I have here Owen Bubbers.
Hi everyone, great to have you on the call.
Yeah, fantastic. It's brilliant that you're here, Owen. Owen leads our resolution team. He's the team leader on the resolution team, and he manages our team of resolution consultants. You're out there on the front line, Owen, helping to resolve some of these issues and embed a culture of mediation into the NHS and other organisations.
Absolutely. We've done a lot of work, both myself and our team, working with NHS partners on a wide range of issues, particularly training mediation staff, but also a much more kind of organisational development perspective as well. So really pleased to be on the call with you.
Fantastic. Well, a very warm welcome, Owen. And Karen. Karen Snuggs, she's been with TCM now for just over a year, I think, Karen. And Karen's our senior account manager, formerly a nurse, Karen, working in the NHS. So a warm welcome to you also.
Thank you. Hi, everybody. Yes, I trained as an RGN and worked in the NHS for 20 years in various trusts within London. So I have my own unique understanding of some of the issues that the NHS face daily. So welcome to you all, and I hope you all enjoy this webinar.
Fantastic, Karen. Thank you very much. It's brilliant to have you here today as well. So the webinar is going to last for about 45 minutes. It depends on how many questions you ask, but you should have in front of you a little panel, and on the panel you can ask us questions. So if you've got any questions for Owen, Karen, or myself, feel free to put them into the box, and we will take time to answer your questions and do our utmost to answer them as the session's running. It is being recorded, and it will be put onto YouTube after the webinar has been completed. We'll also transcribe it, type it up, and we'll put it onto our website. So feel free to share this with anyone, any colleagues or others who weren't able to make it today. There'll be polls and questions that I've mentioned throughout, and everyone who's on the webinar who hasn't had a copy already, because I've been distributing this out for the last 2 years, trying to generate the resolution revolution, as I call it, encouraging the model resolution policy as an alternative to grievance procedures. Oh, grievance procedures. Don't get me started, Owen, how damaging they can be to relationships. We're going to talk about the grievance procedure and how we can move away from that vernacular within the NHS Trust, and we'll provide a copy of that policy for all of you who are interested today. So please sit back, enjoy, and I hope that you'll find something useful to take away from today to use. So a little bit about TCM. We are passionate about workplace relationships. Unfortunately, as mediators, we often see things when they've gone wrong, but we also see things when they go right. The power when people sit in a room, talk, listen, engage, understand, and drive the kind of change that we need to be able to promote stronger relationships. So we help across the NHS and other organisations, employees, leaders, teams, organisations to achieve their full potential by removing these barriers of conflict, change, and communication breakdown. We're not just there for the bad times, we're there for the good times. We're helping to build stronger, productive, more effective teams. We've been doing it for 14 years. We were very much at the front running in terms of formal mediation and dispute resolution programs. We've set up over 300 integrated resolution schemes in organisations across the UK with a really strong track record in the NHS as well. We provide leadership and management training and support for NHS organisations to develop better, what they call soft skills, but hard skills, important skills for managers and leaders within the NHS. And we also provide accredited mediator training, and we'll talk a little bit more about that. So that's a bit about our organisation. And we've worked with numerous NHS trusts across the UK, and that's growing. We were by a long chalk the market leader for dispute resolution in the NHS here in the UK. And I recently wrote, in partnership with NHS employers, and you might have read in the HSJ, a piece that I wrote around the use of mediation. And if you're interested in receiving a copy of the report produced in conjunction with TCM and NHS employers, please let me know, and I'll be pleased to send that out to you. But we will call on some of that during the webinar today. So the challenges that we're going to face, that we'll address today and that we'll explore during the course of the webinar. So we're going to look at the changing landscape of dispute resolution in the NHS. Why are we shifting away from an adversarial blame approach to dispute resolution to a collaborative consensus-based approach to dispute resolution? What is happening? As I've mentioned, there's a resolution in resolution happening. Get my tongue around that particular one. But it's happening right now. But why is it happening? Why are organisations rejecting the traditional approaches to dispute resolution? We're going to look at that in more detail. Over 85% of NHS trusts are using mediation according to the data collected by NHS employers and ourselves. So a lot of you are using mediation as well. However, what we're seeing in organisations is struggling to get traction. People are fearful of it, they're unsure of it, they're sceptical, they're doubtful. So a number of NHS organisations that have mediation in place are reporting a low usage and a low take-up of mediation. Why is that? Well, part of it, I think, is about people that understand what it is and how it works. And certainly today we'll be focusing more on demystifying mediation. So you can go back and let your employees, your managers, your unions and other key partners know about what mediation is and how it works in order to be able to secure that commitment. So how are organisations demonstrating the need for mediation? We'll look at that and the evidence that's being gathered. And we'll also look about how mediation is being integrated into the NHS organisation, not just in relation to workplace issues, in terms of team issues, in terms of patient complaints, in terms of boardroom disputes. It's being used widely in a number of issues across the NHS. And I'd like to explore today how and where mediation is being used. So we know, those of you who are in an HR environment or a leadership environment, that you are dealing with this stuff every day. And at one level, we might see this as just a petty disagreement, a falling out, not seeing eye to eye. And perhaps in these kind of cases, we would expect our managers and our leaders to bring the parties together. Of course, what the managers and leaders think they've got to do is bang heads together. And it's perhaps the attempt to have a difficult conversation and resolve it doesn't happen because our managers and leaders aren't equipped with the skills that they need to have a confident or courageous conversation to resolve these issues. Of course, as it escalates, we start to hear the language of grievance and bullying. We start to talk about absence and attrition and cost. Human resources professionals get involved, unions get involved. The whole thing feels like it's becoming entrenched, polarised, much more difficult to deal with. Of course, what we try and do here is resolve the issues by bringing the parties together, getting them talking to each other. And for many NHS trusts, there's provision for that to happen. But where it doesn't happen or that fails, then we start to see a real escalation. The language becomes conciliation, early conciliation, employment tribunal, absence, litigation, cost, money. And sorry, Karen.
Apologies.
No,
just on the thing of cost. The NHS 5-year forward review was published last year, and they're saying that the taxpayers are paying £22 billion a year because of sickness absence within the NHS. And a lot of that is due to conflict. They're off on work-related stress due to either informal, they haven't made it formal, they've just gone off sick, or actually within a formal grievance process. And that can't be right. £22 billion of NHS money being spent on something that can be resolved at a very early stage.
At a much earlier stage. I think this is really important. I think the statistics are important. And what's good news about the forward plan is it's showing that the NHS is starting to recognise this is a real impact.
Absolutely.
And there's, we'll talk about the Freedom to Speak Up review by Sir Robert Francis, of course, and talking about the emphasis being placed on people being able to speak up and speak out about the challenges in their workplace, but also the experience people have when they go about doing that. And the problem that we face in many organisations, and I think the NHS in particular, is we often wait for the situation to have escalated before we start to really deal with it.
Yeah, well, that's the biggest problem, isn't it?
Absolutely.
It's always, and I mean, you mentioned Robert Francis's review, and he actually states in that mediation and dispute resolution consideration should be given at an early stage for the use of expert interventions to resolve conflicts, rebuild trust, and support staff who've raised concerns. So it's all about the earlier that you start recognising and dealing with these issues, the less likely it will go to a formal grievance procedure. Thus, the cost savings are evident.
Absolutely.
And that's what this is all about. It's about making sure that the NHS, first of all, take their wellbeing of their employees to heart, but also stop spending 22 billion on grievances.
Absolutely. And it's all, the problem is it's a waste of money.
Absolutely.
It doesn't resolve the root cause of the problems. And I think there's a real issue here in relation to a cultural change that's happening within organisations, this resolution revolution, because there's a recognition that actually nipping issues in the bud actually does create a more productive workforce, a happier workforce, a healthier workforce, a more engaged workforce. Leaving it to the very end costs extraordinary amounts of money, but actually no one walks away happy.
It's a lose-lose, isn't it?
It's a lose-lose. And it's fascinating to me that organisations spend and invest the vast majority of time and money on a process which is bound to fail. But actually putting something in place earlier, by training managers and leaders, by HR acting differently, and I think we'll be talking around the triumvirate of HR, unions and managers a lot during this webinar today, the Holy Trinity as I call them, about how us, need to act and behave differently to drive a culture of constructive resolution in our NHS organisations. And as I'll be saying today, our grievance and bullying and harassment procedures aren't resolution policies, they're escalation policies. And simply what they provide is a mechanism by which people can escalate their problems through the policy. So the policy, and this is a paradox which we have to address today in today's webinar. And I'd be very interested to hear, Owen, from some of your thoughts around, and also some of your thoughts who are listening to that. But what that creates, it creates a pathway and a mechanism by which people can escalate their disputes. The paradox is the very processes that are in place to resolve the disputes actually worsen them. And how can we get into the position whereby that happens?
Can I just come in there for one moment? It really brings to my mind a couple of mediations I've done fairly recent in the last few months. And that's a question that we often raise, which is that two parties or a team, especially two parties, may go through, put a grievance through, that goes through the process. And suppose then that the process comes to an end, whatever the outcome, both parties continue to work within the organisation values those members of staff. The question I always like to ask, and actually it's a really important question to ask as you put it out to the parties, is Monday morning, 9 o'clock, the day after, the next start of that next week following that process, what happens? Because both those parties still have to walk through the door.
Yeah.
What's going to happen when they walk up to their workstations and they see each other the first time? And you ask that question, and the most common answer is silence.
Absolutely.
And there's not an answer. And that's a very important point for these parties, that moment of realisation, I think.
Absolutely. Absolutely. Thank you, Owen. So we're looking now at the Freedom to Speak Up review led by Sir Robert Francis QC, and as I'm sure you'll be familiar with the report, and there's the website there if you need to download it and have a read. However, the initial terms of reference for the review were to provide independent advice and recommendations to the Secretary of State for Health on measures to ensure that NHS workers, including those working within mental health services in England, can make disclosures about any aspect of the quality of care, malpractice or wrongdoing at work, confident that they will be listened to and that appropriate action will be taken. In addition, they should know that they will not suffer detriment as a result of that, and if they're mistreated, there will be appropriate remedies, and those mistreating them will be held to account. So what's really interesting in here, through Francis, obviously, the initial mid-staff's review, the work by Bruce Keogh from NHS England, and of course now the Freedom to Speak Up review, is shining a light into the NHS and say there are problems. It's impacting patients, it's impacting employees. And what that light is shining upon is recognising that the way that people interact and engage with each other within the NHS isn't allowing for issues to be raised in a constructive or positive way in order that structural or systemic or other changes can happen. And as a result of that, issues are suppressed. Now, I know as a mediator of some 15 years that when people are fearful, they suppress issues. The challenge that we have in the NHS is when people suppress issues, they get stressed. We're suppressing very strong feelings. A, they get very stressed. And B, issues that should be brought to light aren't being brought to light. So the question we have to tackle is, why are people so fearful? And the reason people are fearful, as Sir Robert Francis said, is that 30% of people who raised a concern felt that they felt unsafe after they'd done so. 18% said they didn't trust the system to speak out. 15% said they felt victimised. If these are people's real experiences of speaking out in the NHS, is it any wonder that issues are being suppressed and not talked about? Now, the challenge for NHS leaders, I perceive, is how do we create a mechanism? What Sir Robert Francis has done is highlighted very clearly and matter-of-factly what the challenges are. I was absolutely delighted when I read Principle 9 in his report, which said that mediation and dispute resolution services should be given consideration at the earliest possible stage, and that expert intervention should be used to be able to resolve conflicts, rebuild trust, and support staff who raise concerns. And I would absolutely reinforce that message. There is no better way of talking openly and freely about your real issues and your real concerns than through a process of open and honest dialogue through mediation.
Just coming in there, one of the questions that strikes me, and maybe on the mind of some of the people who are on this webinar today, is, I think great way to get your views, David and Karen, is we talk, there's that recognition there from Principle 9. Day to day, we know that some members more senior of the organisation may be quite sceptical around mediation and its efficacy. And I'm wondering, David, how can we work to make sure that those who are in very powerful positions, particularly in the clinical side, consultants, for example, how can we ensure and support consultants to make sure they are brought into the process of mediation as well?
Absolutely, an absolutely vital question. A lot of the work we've done, and we'll draw on the experience of NHS, the Northumbria NHS Trust, and the report that's written by ACAS, we do a lot of work to ensure that the clinicians are an active key driver in the development of a multidisciplinary dispute resolution programme within the NHS that's fully integrated. The first thing we need to do is involve them, Owen, in the shaping of the dispute resolution system. The second thing we need to do is to empower them to actually act as mediators, and there's a fantastic consultant in the Northumbria NHS Trust mediation scheme who is out there promoting mediation to clinicians, working with the General Medical Council and the BMA in particular to really promote mediation and elsewhere to promote mediation for clinicians and consultants. And I've done a lot of work with a consultant team, bringing them together through mediation. And when it starts, you can almost see their eyes rolling with what is this namby-pamby, soft and fluffy mediation process all about. But at the end of it, I have one particular case in mind where I went in and worked with a surgical team, with an orthopaedic surgical team, and spent several days on site working with them. At first, they didn't trust me, they didn't like me, they didn't understand me, they certainly didn't have any validation or respect for the mediation process. By the end of it, and I had them all sat in a room talking about their issues and their challenges, they were engaging fully. They recognised this was one of the toughest things that they'd probably ever done. And what was absolutely remarkable for me as a result of sitting down and talking and listening to each other, the stuff that they called namby-pamby and soft and fluffy, we actually started to see behavioural change. They wanted to change the way that they were working. They just didn't know how to. And I think for me, it's about engaging them in every aspect of the shape and the design of a conflict management initiative, and recognising that without their involvement, as well as other involvement from nurses and other employees and support staff and others, potentially patients as well, in helping to shape a fully integrated mediation programme, they won't work effectively. And one thing's for absolute certain, if you have mediation written into your grievance procedure, which many of you have, it is doomed to failure. It will not work. Grievance procedures and mediation are like oil and water. You can shake them up and they might mix for a little while, but after a little while they will settle. Mediation and grievance are so at polar opposites in terms of their philosophy and values that they will not work if mediation is written into your grievance procedure. In order to go into a grievance procedure, you have to be aggrieved. You're going to take out a grievance against the other person. You already know that your relationship will be torn asunder and will never be the same again. And then someone puts their hand up in the air and says, oh, would you like to mediate with the other person? Well, not really, thank you very much. Well, I'll give it a go because I have to tick the box. And one of the interesting things that I say to NHS Trust is we need to separate our grievance procedures and mediation. In actual fact, the best advice I can give to HR professionals is take the grievance procedure to the nearest shredding machine and ask ourselves a really important question. Does the grievance procedure add any value to the organisation? And I don't mean procedural fairness and meeting the ACAS code and risk aversion, all of these things I understand. I mean adding real value to your patient experience and your employee's experience. And I'll be coming to this and I'll be suggesting it doesn't add any value. In fact, it impedes the good running of an organisation, an NHS organisation.
Just a thought. Thank you, David. One thing that, again, is on my mind, and maybe reminds people involved in this webinar, is that might sound really great, a lot of passion, fantastic, but is mediation, can it really be applicable to a full gamut of cases that come across an HR professional's desk? Maybe sure, there's one or two areas we know it can work with confidence in that, but actually, is it relevant? Is it realistic for the full range of problems and challenges that an HR professional is going to come across every single day? How would you answer, especially around patient complaints cases, for example?
Let me draw an example. A great question, really powerful question. We run the mediation program for Royal Mail Group. We run their industrial relations mediation program and also their bullying and harassment mediation program. We ran a webinar. Jane Fairhurst, head of industrial and employee relations, spoke passionately about the role of mediation. We mediate in over 30% of the bullying and harassment cases that come through Royal Mail. Now, Royal Mail have a penchant for bullying and harassment cases. They know how to get bullying and harassment cases. Some of them are most difficult mediation cases that I've ever personally worked on. I know, Owen, members of your team have been out there dealing with them. We're talking about power imbalance, communication breakdown, the stuff here, clash of values, broken promises, loss of trust, lack of respect, really difficult stuff. And what the mediator is able to do is work with the parties to bring them together. And I would say this to anyone who's thinking about where mediation can work, is if the parties are willing to give it a go, then mediation can solve any problem that we can experience as human beings. It's all hinged on the parties' willingness to engage with each other in a meaningful way. If two human beings, two adults, are willing to sit in a room with each other, with the help of a skilled third-party mediator, I've mediated in race discrimination claims, transgender issues, sexual discrimination allegations, team disputes, complex disputes, many of which HR professionals, I think, would say, hang on, that can't be resolved. I love this when it happens. The next day you get a phone call from the HR director. What did you put in their coffee? How did you do that? Because we've thrown everything at this problem. We've tried everything. And I'll look and I'll say, well, look, tell me what you've done. We've investigated, we've heard, they've taken diary notes, we've recorded it. So, but has anyone actually sat down and listened to these people to really understand what their hopes and needs and goals and aspirations and fears and concerns are in such a way as we can validate that and understand it and empathise with it and then bring them together? And often when I ask that question, HR professionals scratch their heads and say to me, in all honesty, we probably haven't done that bit. And it's that bit that's missing. It's that bit that's lacking in our conflict management strategies. How many of you in your grievance procedures have the word empathy? How many of you would have empathy as a core value or part of your philosophy? Everyone who's on this webinar. How many of you have that philosophy or value embedded into your grievance or bullying and harassment frameworks? Very few. I've only ever seen empathy written once in an HR policy. Now, empathy isn't the be-all and end-all, but empathy is a key attribute of the mediator, and it's something that's a key human need we have to be understood, to be validated, to be recognised, to be heard by the other person or by a mediator. And where that is in absentia, it becomes almost impossible to resolve the dispute. So it's no surprise to me that I get asked, what did you put in their coffee? I'll tell you what I put in their coffee: a good dose of empathy, a good listening to, a good absence of non-judgmentalism. Is that such a word? I don't know.
It is now.
It is now.
Sounds good.
It sounds good. That's what we put in their coffee. So all of this stuff is going, they're in dispute, they're shouting, they're screaming. What do we do in these situations? Well, these are driven by strong, powerful emotional and psychological reactions to conflict, which I'll explore in a moment. And these issues can escalate very quickly. And what the escalation in a conflict often results in is a polarity or a binary position or an entrenchment between the parties. I'm right, you're wrong, I win, you lose, I defend, you're attacked, you're a bully, it's your fault, who do you think you are? And this language becomes very polarised. And unfortunately, through our policies and our procedures, which in themselves are binary, they are based on a winner, a loser, right, wrong, they're quasi-judicial in nature, they actually subconsciously encourage these behaviours. And I'll often talk to HR directors and talk at conferences and at seminars, and people are tearing their hair out with the bad behaviours that their employees are demonstrating. They can't get their short-term absence down, they can't get their long-term absence down, they're losing good people. The grievance levels are high, the engagement levels are low, and people are tearing their hair out. And it's very uncomfortable when I stand at a conference and say, well, actually, you're the architect of these problems. Your organisation has designed these problems in. It's the architecture of our frameworks within our organisations which are intrinsically adversarial, which encourage this adversarial polarity that exists between our parties. And by introducing mediation into NHS organisations, we're starting to introduce a change in the way that we perceive conflict. We no longer see conflict as a series of destructive behaviours. So if you look on the left-hand side of the picture, they're destructive behaviours. HR professionals are well skilled at tackling destructive behaviours. We can investigate, we can test that on the balance of probability, and as long as we've been doing a reasonable investigation, we'll pass the virtual test at an employment tribunal, and we know that we've prevented any risk to our organisation. So our dispute resolution systems are about reducing risk to the employer in an employment tribunal. On the balance of probability, we can undertake a reasonable investigation. Very few, and it is changing, the good news is it's changing, very few dispute resolution systems are about identifying root cause. And if I work with an organisation looking at serious untoward incidents or serious incident management, I will do a lot of work around root cause analysis, 5 whys, getting to the root of an issue in order to be able to drive systemic change. But when it comes to managing interpersonal conflicts, we forget all of that. We just test on the balance of probability whether you're right or whether you're wrong. And what the mediator does is we do assess root cause. We do need to understand what's going on. And at the heart of conflict are unmet needs. They need to be valued and respected, heard, taken seriously, treated with respect. And when those things don't happen, we experience a profound sense of loss, a loss of hope, esteem, confidence. As Martin Seligman rightly reminds us time and time again, a loss of control is one of the major drivers of emotional harm, stress, and other problems, health problems for human beings. So we then react to this sense of loss. The amygdala, this tiny part of the brain which is firing away, driving these strong emotional responses, the adrenaline, the cortisol, the fight, the flight, bang, 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 bang. And that impacts on how we act, interact, and react. And that then drives the destructive behaviours. So if we only address the destructive behaviours, we're only addressing what's above the iceberg. And there's so much more to work with. So one of the best pieces of advice I can give to anyone on this webinar who's dealing with conflicts is give the parties a jolly good listening to and ask them, what do you need? Not what do you want, because I know what you want them sacked. But what do you, if you had them sacked, what would you need? Well, I'd feel safer. Okay, so you need safety. How can we work together to ensure you feel safer? She never listens. So what I'm hearing you say is you need to be heard. Tell me what you need her to do to listen to you. What's blocking that? How do you feel when you're not heard? And what we can do is we then transform, and this is a transformative process. We transform the conflict from destructive and harmful to constructive and collaborative. That's a very powerful process.
Recently, myself and David went to meet with some board members, union reps and HR managers of an NHS Trust off the back of an employee staff survey. And they were very confused because the employee survey demonstrated that a lot of their employees felt undervalued, bullying and harassment was highlighted, but they weren't getting like a huge increase in formal grievances. And it goes back to the fact that people are frightened, it's fear. They're worried about, if I complain about this openly, in a formal way, how is that going to affect me? So they're doing it in staff surveys anonymously. So NHS Trusts, and it's not only NHS Trusts, but organisations are seeing the results of these staff surveys, telling them there is an underlying problem, but not knowing how to deal with it. And that's where TCM come in and can help get an understanding of why your staff surveys are saying one thing, but your formal grievances are saying something else. And it's important for you to understand there is a disparity. And if you haven't done an employment survey recently and you're planning to do one, you may well come across that.
Absolutely. We had a question, Julie. Thank you very much for your question. So, Julie, you're saying that you agree with nipping issues in the bud, but you've got a particularly challenging case you've talked about here. So, thanks for sharing this. You talked about employees being informally monitored for their sickness absence. They're stating that they're stressed, but they're avoiding attending meetings to discuss this with you further. To date, 6 meetings have been offered, dates have been offered with agreement to meet tomorrow with their union rep. However, today they've rung in citing sickness due to stress. Wow, that's a difficult situation to deal with. And I imagine that creates its own level of stress, Julie, for you and for your colleagues who are wanting to be able to resolve this. The challenge is, and you're doing the right thing, I think you're doing the right thing, you're wanting to meet with the individual. The challenge would be, as a mediator, if I was talking to this employee, I'd be asking her, or I think was it her, her or him, as to why they are fearful about coming into the room to be able to talk with you. Now, what is it that they're concerned about? Why do they not feel able to have that conversation with you? And that's about building confidence in that individual to be able to come into a meeting. Now, this is a really interesting challenge in relation to stress and sickness absence. One thing is for sure, you can't get better watching Homes Under the Hammer. My experience is that when you're at home due to work-related sickness and stress, particularly related to conflict, the sooner you get back into the workplace, the better. Because it's about resolving issues, and what happens often is the organisation is moving at a pace and the individual is at home and they are reliving this every moment, every day. They're waking up in the middle of the night, they're reliving it. They're waking up in the morning, they're reliving it. They're going to bed at night, they're reliving it. They're thinking about it all the time. And what I would say, Julie, is this person is reliving this, whatever it is that's caused them to go out for stress, all the time, constantly reliving it. And it seems to me that you're doing the right thing to want to have a conversation with them, but I'd also urge compassion and sensitivity to the challenges that this person is facing. And sometimes it can be difficult walking through the doors of your organisation. I remember talking to one lady, it was a while ago, she said, it feels like I've got bricks in my belly every time I walk through the door to my workplace. Now, bearing that in mind, what I would suggest is, and I'm sure you would use this, is thinking about your emotional intelligence. How can you be empathetic and compassionate in the conversations that you have? But that also needs to be balanced against your right as the employer to challenge these issues and to address these issues assertively. And this is why mediation can be really useful as part of return to work programs, as part of absence management programs, and supporting HR professionals returning employees to the workplace. And for me, a 2-week cut-off should be absolutely key. Within 2 weeks, you're actively seeking to return the employee to the workplace. I mean, I'll give you a good example. It's holiday time's coming up. We're all going to be going on our holidays, maybe a week or 2 weeks, hopefully somewhere nice and sunny, doing something nice and relaxing. I know that when I come back from my week's holiday, on the Sunday, I'm probably thinking, oh, I've got to go to work tomorrow on the Monday. Well, I've just had a nice relaxing week of reading books and spending time with my kids, and I don't want to go to work. Imagine if the last time that you walked out of the workplace, you were screaming at your manager was screaming at you, your colleagues were ducking down, everyone was stressed out, and then you're trying to return to the workplace. So I would suggest that we spend a lot of time thinking about how we do this, Julie, and building in mediation to support those very, very, very difficult conversations. The need for change is compelling, it's right now. There's an increasing recognition that this is costing your trust real money, and at a time of significant cutbacks and further cutbacks still, can we afford to be hemorrhaging money on absence, attrition, tribunals, settlement agreements, and all of the costs? I would suggest no.
No, absolutely. It's the NHS.
We can't continue. The status quo cannot remain, and we cannot rely on systems and processes that were designed in the 1970s. And thanks ACAS, we did a great job. You designed them for us in the 1970s. They've got us to where we are now. They are no longer fit for purpose. The reduced productivity is a massive agenda for the NHS. It is for the organisations in the UK. How can you be productive when you're sat at home? How can you be productive when you're not sharing information in a clinic? How can you be productive when there's a poorly managed ward handover in the wards? It cannot work effectively because it's impacting on productivity. The amount of time that's taken, the amount of absence, attrition, cover costs. I mean, we haven't even talked about locums and cover costs when people are at work. The legal fees, employment tribunals, engagements, satisfaction. The list goes on and on. And one of the things we provide, and if you're interested, I'm happy to provide this for you, is a calculator, an audit, a toolbox, similar to the one I ran within Northumbria Healthcare NHS Trusts, helping them to codify and measure the true cost of conflict. And what Northumbria did, you might have read, they did a case study as part of the NHS Employers Report, and they published in THSJ. And one of the pieces of research that they did publish was that they identified that each grievance costs around about £2,000 a year. That's just in terms of time and visible costs, so they include human costs. whereas the actual cost of running a mediation, they said, was around about £250. So the cost of that trust was significant, the cost savings. So we established that mediation programme about 10 years ago, and almost 60% of people who were researched as part of this massive document, is one of the most thorough analysis of mediation in any organisation.
Well, certainly within the NHS, without doubt.
Has been groundbreaking, and over 60% of people identified that they prefer to resolve issues informally. And what Teresa Jennings and colleagues at Northumbria Healthcare Trust did is they blended together the mediation, conflict coaching and team facilitation work with a programme of training and continuing professional development. And we at TCM were at the heart of that, and we've been proud to be working with that trust to drive this culture of resolution, a recognition that policies and procedures gave people something to hide behind. How many times do we hear this? The policies and procedures are giving people something to hide behind. They're not resolving the issues. And the survey showed that amongst the most senior managers, 73 valued conflict handling ability as a critical or very important skill. And that's something I think is worth bearing in mind, because is conflict management a core competence in your consultancy competencies or in your leadership competencies? If it's not, it absolutely needs to be. And again, we work with this trust amongst other trusts to help them embed conflict competence as a key competence for their leaders and their managers. So a quick poll, it's our first of our two polls. So the first poll is, do you currently use mediation in your organisation? It's just to get a sense check about who's currently using mediation. So you've got 5 options: yes in workplace disputes, yes in patient complaints, yes in team disputes, yes other, and currently no. So I'll keep this open. It's just a straw poll to see how many of you are using mediation. You can tick as many or as few boxes, I think, as you wish. Okay, so half of you have voted, so just wait for the other half to come in. I'll keep the poll open for another 5 seconds. 4, 3, 2, 1. Okay, I'm going to close the poll. So 85% of you have voted in this poll. So I can share the poll with you now. So you should be able to see on the screen in front of you the poll there. So let me just have a look here at the poll. So 36% of you are using mediation in workplace disputes. That's interesting. It's actually lower than the NHS employers figures suggested. 9% are using it in patient complaint. That's great. It's an area we're going to touch upon today. 18% in team disputes. 9% in yes and other. It'd be interesting if you wanted to tell us where you're using it. For those of you who put other, please do put that into the comments box or into the questions box. We'd be very interested to hear that. 27% of you aren't using mediation as well. It's very interesting. So hopefully today we can give you more information about the efficacy and use of mediation. So thanks very much for sharing your thoughts and being part of that poll. So let me just hide that now and we'll carry on with the presentation. So opportunity for questions and answers. I don't know if you have any, feel free to ask if you have, but are there any further questions, Karen or Owen, before we move on and start looking in more detail about mediation?
I guess for me, a question that's come up, and we've touched on it, is around the issue of well-being. She's talked about the cost, the human cost, the financial cost of conflict. Often we have this, we assume that because conflict may take place in the workplace and professional setting, that actually we're very good at separating the professional from the personal.
Yeah.
So you walk up through the doors at 5:30, actually, we put it behind us. As a mediator, it's anything but that.
Yeah.
We take it home, we own the stuff. We have phenomenal capacity to hold on to this for months and years.
Absolutely.
And it manifests itself in medical issues. You can't sleep at night. You're getting a bit, you fight, you get argue with your family sometimes, all these things. I'm just wondering in terms of when it comes to the case of efficacy of mediation and well-being, stuff that people can point to, evidence that people can demonstrate that to help employers make that case can really support their employees around well-being.
Absolutely. Well, one of the things that we do is we're starting to do more and more with organisations with resolution audits, and there are 3 elements that we triangulate in resolution audits. So we look at grievance data, staff satisfaction data, and stress and well-being data. And we've started working with an increasing number of organisations to start to pull that data together. And so there's not specific evidence yet, but I think that's going to emerge over the coming months. What anecdotally we're seeing from these audits, however, is there's a direct correlation between unresolved conflict in the workplace workplace and high levels of stress. In fact, when we've been talking to people as part of our stress audits and talking and examining people's reaction to stress in the workplace, at the heart often of that is a breakdown of the psychological contract between them and their manager. In actual fact, stress in the workplace is being derived in many, many, many cases by a breakdown in relations between, or breakdown of the psychological contract. But we will be publishing more, and there'll be more data becoming available on that topic.
And just one other quick point there, building what you just said there, David, about the breakdown of psychological contract with your manager. Also, as a mediator, what I often hear about is there may be a conflict between two people, a line manager, direct report, seemingly not related to the wider organisation. But it's remarkable and quite worrying how quickly that conflict can actually spill over into apathy for the broader organisation, further break down that psychological contract between the employee and the employer.
Absolutely, and imagine how that apathy might play out on a clinic or on a ward. It's impacting on patient experience, and as Keo was finding in his review a couple of years ago, it was impacting on patient mortality. It's having a significant effect, not just on employees, but on patients. And I think that more needs to be done to analyse the impact of these issues, Owen. I think it's a really important point you made. But this isn't just a shop. I mean, not to say a shop would be any better, but this is about creating healthier patients. Resolving patients' issues. If people are apathetic, demotivated, unhappy, that has a direct impact on patient experience. And I think this is something that needs to be understood and analysed more. So I'd like to just go into mediation now and spend I know many of you are already using mediation, so just to touch on some of the key points, but it's about listening. Every good conversation starts with listening. So mediation is a tool for talking and listening. That's what it is, it's talking and listening. It's widely accepted as best practice for managers in HR. There's a recognition increasingly of the real cost of conflict. There's also a recognition, as you've been talking about and alluding to there, that it's underpinning engagement, well-being, performance, productivity, customer care, and other aspects of organisations. We're seeing a significant shift in the last 8 or 9 years away from the employment tribunal to local and early resolution. The problem we have is whilst the government have been promoting this and ACAS have been promoting this, there's no clear single message going to the HR community about how to make this happen and bring it into a reality. So when I go through grievance procedures in many organisations, they still mirror the modified 3-step dispute resolution regulations that were repealed in 2008, 7 years ago. There's not been, and there needs to be, a significant shift in focus in these resolution approaches within organisations. The legal reforms, notwithstanding the political debate that's raging now in relation to access to justice, however, the reforms that the government, the previous government, the coalition government and the current government are promoting are about early resolution and local resolution. And of course, the Francis review, the Freedom to Speak Up review, brings this into sharp relief for many NHS trusts. So mediation is about resolving our issues informally, in a non-adversarial way. Mediation is a framework of dispute resolution, of a mediator intervening. It's a set of skills and it's a mindset that we can apply. And the agreement, this is where it's really important. The mediation process allows the parties to reach their own agreement. It doesn't come from the mediator, it comes from the parties themselves. And there's an example of a mediation space. This is what a mediation looks like. Here our mediator has our two parties, they're talking and they're listening, and the mediator's role is to control and manage that process so it's safe and constructive. It's incredibly powerful, and I run a lot of webinars in real detail about what happens in that mediation room. But we established some safe ground, some safety principles, some ground rules, some guidelines, and we encourage the parties to talk openly and honestly about their needs, their goals, their hopes, their fears, their opinions, their perceptions, their anxieties, their concerns. It's a future-focused process because it's about building a stronger relationship tomorrow, but it does allow the parties to explore what happened yesterday, not from the point of view of blame and retribution or sanction, but from the perspective of learning and understanding and recognition. Wow, what a change.
It's got to be cultural change, though, David. That's the whole thing. It has to be embedded in the culture of HR and within the NHS. I mean, you look at these reviews that are coming out, the Francis review, he says it's about a culture of visible leadership. Yeah. You look at the ACAS report, it's about how the culture has been changed, and that's what we need to do. I was a nurse for 20 years and I worked in various trusts, and they've all been different, they've all used different approaches, and the one thing I will say, I was a nurse manager. And I thought I was quite a good nurse manager, but having come into an organisation looking at mediation and some of the issues that I've learned about since coming here, I realised actually you might have been an all right manager, but you could have been much better.
Yeah.
And one of the things that I could have done better is having a difficult conversation at a much earlier stage.
Fabulous. That's absolutely right. And this is some of the benefits. So, you know, there's endless benefits to this approach. It's about building confidence, reducing costs, reducing the amount of time and energy spent on tackling these issues. And we work with NHS Trusts. We've set up mediation programs from BMA and NHS Blood and Transplant and acute trusts, primary care organisations, mental health trusts and ambulance trusts. And we always start by building a system to gather the evidence and the data about the effectiveness of their mediation programme. And here is just some of the benefits that NHS organisations can achieve through introducing a mediation programme. The Royal Marsden is an interesting organisation we've been working with recently. So it's very new, but Lisa Needham, the diversity manager at the Royal Marsden, shared some of her experience. I thought this might be useful to share because these are the Royal Marsden's taken its first tentative steps into mediation, like I'm sure many of you have done or will remember. And what I thought was interesting for the Marsden was the basis. Why were they doing this? I asked Lisa, why were you doing this? And she was going to talk today, but unfortunately wasn't available. So she provided some data for today's webinar. So they were interested in reducing the cost of complex employee relations cases, enhancing staff health and wellbeing, providing an alternative to formal hearings, and improving team performance and relationships. And we've set up an accredited mediation programme within the Trust. We've trained managers and leaders and others within the Marsden. And what I'd like to be able to do is to report back some of the benefits that the Marsden benefit, as we have done with Northumbria Healthcare Trust, but focusing in particular on these 4 drivers, because I'm sure many of you would recognise those. There's the need for drivers for change within your own organisations.
Yeah, absolutely. I mean, I spoke at length with Lisa about how this scheme is working for them, and they're now looking at how they're going to improve it, expand it. You know, that they're really assessing it and evaluating it because they've already started to see the benefits. That's the thing. You know, a very short period of time has passed since completion and now, and she's already recognising the cost saving, but also the savings in time for people within the HR department, because that's the other thing that we talk about, money all the time. But it's about the work that goes into it, and you know. So the Royal Marsden are on top of it, guys. Absolutely. You need to be too.
Thank you, Karen. So we're coming to the end of the webinar. So thank you for staying with us for this. So we provide training for managers and leaders and others in terms of helping to resolve these issues. And I think a lot of it starts and ends with the manager. If the managers and leaders can resolve these issues at source, then a lot of these problems won't escalate. But again, as I've mentioned, when I'm looking at leadership competences, these skills are not clearly codified and stated, and I would suggest that they need to be. These aren't soft skills. These are tough, hard skills that every manager should have in their portfolio of training. Please do ask any further questions, but what we're trying to do is move away from a grievance culture to a resolution culture. And as I've mentioned in the text and elsewhere, I'll provide you with a free copy of the resolution policy. This is a real alternative to the grievance procedure. Big banks, big authorities, local authorities, NHS Trusts and others are now adopting the TCM model resolution policy as an alternative to their grievance procedure. What a wonderful world. You can't just go around taking grievances out against each other. You request resolution with each other. Even the change of the vernacular changes, but it's also a change in process, system, structure. But of course, it still meets the minimum. If you're concerned about this, it still meets the minimum requirements of the ACAS code on discipline and grievance. It's been stress tested by ACAS, by lawyers, and through a number of organisations. So there's possible approaches. We'll be developing an internal mediation scheme like Northumbria NHS Trust, training your managers and leaders, training HR to hold and run facilitated conversations, such a powerful role for HR, the triumvirate of HR unions and managers. Training a team of internal mediators to troubleshoot problems. Over 95% of cases that are mediated within Royal Mail Group are resolved through mediation. 95, these are tough bullying cases.
And they're bullying and harassment cases, and you know, I've seen some of them, and they've got an agreement, and it's just an amazing process. It really is.
Absolutely. And of course at TCM we provide independent conciliation, mediation, adjudication, evaluation and appeals services to NHS organisations. So we work at board level right the way through all aspects of the organisation.
Yeah.
I wanted to just touch on very, very briefly, I know we're running out of time, but I wanted to talk about patient complaints, because I know a number of you are interested in that. And for me, when I'm developing a workplace resolution scheme using mediation, I'm certainly within the NHS, I'm now paying equal attention to patient complaints as much as employee complaints.
Yeah.
And this approach can work equally as well in patient complaints as they can do in an employment dispute.
Well, it's the same skills. It's
Absolutely.
The listening, and it's, yeah.
Well, here they are.
Yeah.
Here are the skills. So a mediator and a patient complaint between the patient or their family and the clinician would listen, they'd be empathetic, they won't blame, they might encourage people to be able to apologise, they would reframe negative or blocking language, they would avoid reacting defensively, they'd encourage a very open and honest environment. And increasingly, when we train a team of internal workplace mediators, those workplace mediators are also being commissioned to go in and resolve patient complaints. It's a fascinating use of mediation skills driven by HR in partnership with your head of patient experience, which is a fantastic pairing in my experience, because HR and patient experience are absolutely one and the same.
Absolutely.
Working together to drive a positive culture of conflict resolution in the same way we're with employees as we are with patients. And again, we're available to answer questions, and we deliver training for you or for organisations as a result of those organisations who want to increase the use of mediation. So we'll come to the end now. I'm going to run a poll. So the question is, as a result of today and the webinar, the time that we've spent together, would you be interested in extending the use of mediation? There's a yes, a no, and a maybe for those who are undecided. So 40% of you have voted, 46. So I'm going to keep conscious of time, so I'm going to keep it open for another 5 seconds. Over 50% of you have voted. 5, 4, 3, 2, 1. Okay, I'm going to close the poll now. So I'm going to share the results of the poll with you. You should be able to see those on your screen. Fantastic. Karen, we haven't put anyone off.
No, we haven't.
Fantastic. That's great. Over 80% of you would be interested in extending the scope of mediation. Only 13% of you are unsure. Nobody said no. So that's a positive. So this is TCM, 14 years at the forefront of dispute resolution. We can help you set up your mediation scheme. We run our National Certificate in Workplace Mediation. Many of you may have already been trained using that. That's the benchmark standard for NHS mediation training. Numerous trusts have used it. We run audits and diagnostics. The London Ambulance Service recently had a bullying audit done. That's exactly the kind of work that we will do. We can come and do audits around engagement and bullying and grievance. We provide professional mediation services, and we provide professional management and leadership training. Thank you so much for listening. Thank you for participating through your questions. If you've got more questions as a result of the webinar, there's my email address. I'm active on LinkedIn. I've just posted one of my most popular blogs looking at bullying. So if you link up with me, or if you're already connected, I'm blogging regularly now about this topic. But for now, what I'd like to say is thank you so much for joining us. I'd like to say thank you to Karen. Unfortunately, Owen's had to leave us. He's gone to talk to a party in dispute. He's mediating tomorrow, so he had to go and take that call. But thank you to Owen, and a thank you to Karen.
Thank you all very much for joining. I hope some of the things that we've discussed have resonated with you. And I'd just like to leave you with one last thing from my point of view as a nurse. I recently went into a trust, again with Mr. Liddle, and we were in the corporate headquarters. And the first thing we saw on their wall was their charter for their patients. We will do this for our patients. We will do that for our patients. And then we went in and we sat down and we were talking about some of the issues. And I said to them, where's your charter for your staff? Because everywhere we've gone, we've seen your charter for your patients. And they didn't have one. And to me, as an ex-nurse whose heart is still within the NHS, that is something that I would ask you to consider.
Yeah.
Your staff's well-being is vital to the patient's charter. If you don't get your staff's well-being right, the patient's charter may not as well be there.
That's a very,
so thank you very much.
Karen, thank you very much. It's about getting that balance, and thank you so much, Karen. Thank you, everybody. Look forward to, for those of you who know us, continuing to work with you. For those of you new to TCM, I look forward to starting hopefully a very positive and long-lasting relationship. But for now, I will bid you farewell. So thank you all very, very much indeed.
Bye-bye.
Bye-bye.